Smoke less and live more. Smoking damages your lungs, reduces oxygen supply, and increases the risk of serious diseases such as lung cancer, heart disease, and stroke. The good news is that quitting smoking at any stage can significantly improve your health. Every step toward a smoke-free life is a step toward a healthier and longer future. Our daily lifestyle choices shape our future health. Healthy eating, regular exercise, quality sleep, and avoiding tobacco all work together to protect the body. While smoking provides only temporary satisfaction, healthy habits offer lifelong benefits, improving physical strength, mental well-being, and overall quality of life. What's inside cigarettes? A cigarette contains much more than tobacco. It also includes nicotine, tar, carbon monoxide, ammonia, benzene, and many other toxic chemicals. These substances are highly addictive and harmful. They damage the lungs, weaken the immune system, and increase the risk of cancer, heart disease, and respiratory disorders. Cigarette smoke contains over 7,000 chemicals, with hundreds known to be toxic and at least 70 identified as cancer-causing agents. Carbon monoxide reduces oxygen delivery throughout the body, while nicotine causes addiction. Continuous exposure gradually damages nearly every organ and shortens life expectancy. Carbon monoxide and oxygen. When carbon monoxide enters the bloodstream, it replaces oxygen by attaching strongly to hemoglobin. This reduces the amount of oxygen reaching your organs and tissues. As a result, the heart must work harder, increasing fatigue, reducing physical performance, and raising the risk of cardiovascular diseases. Healthy red blood cells transport oxygen efficiently throughout the body. However, after smoking, carbon monoxide binds tightly to hemoglobin, forming carboxyhemoglobin. This blocks oxygen transport, leaving vital organs deprived of the oxygen they need to function properly, especially during physical activity. Gaseous exchange at the alveoli. The alveoli are tiny air sacs where oxygen enters the blood and carbon dioxide leaves the body. Smoking damages these delicate structures, reducing lung elasticity and limiting oxygen exchange. Over time, breathing becomes more difficult, and lung diseases such as emphysema and chronic bronchitis develop. Besides nicotine and carbon monoxide, cigarette smoke contains formaldehyde, ammonia, hydrogen cyanide, and many other dangerous compounds. These chemicals irritate the airways, damage body tissues, weaken the immune system, and contribute to chronic respiratory illnesses and several forms of cancer. Smoking harms almost every part of the body. It damages the lungs, heart, blood vessels, brain, skin, and reproductive organs. Smokers are at higher risk of stroke, heart attack, chronic lung disease, infertility, and weakened immunity. The harmful effects increase with every cigarette smoked. Smoking and blood pressure. Nicotine causes blood vessels to narrow, forcing the heart to pump harder. This temporarily raises blood pressure and heart rate. Over time, repeated exposure places continuous stress on the cardiovascular system, increasing the likelihood of hypertension, heart attacks, strokes, and heart failure. Smoking and atherosclerosis. Smoking accelerates the development of atherosclerosis, a condition where fatty deposits build up inside arteries. Narrowed arteries reduce blood flow to vital organs and increase the risk of heart attacks, strokes, and peripheral artery disease. Quitting smoking slows this harmful process significantly. Smoking and teeth staining. Smoking not only affects internal health but also changes physical appearance. Nicotine and tar stain the teeth, cause persistent bad breath, and increase the risk of gum disease. Smokers often experience yellow teeth, tooth loss, and slower healing after dental procedures. Why avoid e-cigarettes? Although often marketed as safer alternatives, e-cigarettes are not harmless. Many contain nicotine, harmful chemicals, and flavoring agents that can damage the lungs and heart. Long-term health effects are still being studied, making prevention and complete tobacco avoidance the safest choice. World No Tobacco Day. World No Tobacco Day is celebrated every year on May 31 to raise awareness about the dangers of tobacco use. It encourages people to quit smoking, supports healthier lifestyles, and highlights global efforts to reduce tobacco-related illnesses and prevent millions of avoidable deaths. Healthy lungs efficiently supply oxygen to every cell in the body. Smoking weakens lung function, destroys air sacs, and reduces breathing capacity. Quitting smoking allows the lungs to recover gradually, improving breathing, increasing energy levels, and lowering the risk of chronic lung diseases. The hidden risks. Smoking harms more than just smokers. Second-hand smoke exposes family members, children, and co-workers to dangerous chemicals, increasing their risk of asthma, heart disease, lung cancer, and respiratory infections. Protecting yourself also means protecting the people around you. Living smoke-free opens the door to better health. Say no to smoking. Quitting smoking is one of the most important health decisions you can make. Within hours, your body begins repairing itself. Over time, breathing improves, circulation increases, and the risks of heart disease, stroke, and cancer continue to decline. It's never too late to quit. Stay healthy. Thank you for watching. Subscribe our channel BIOCHEMISTRY Minds. Stay tuned for more learning.